You're listening to Vaccination on ReachMD. I'm Dr. Charles Turck, and joining me to discuss how we can protect our patients traveling abroad against dengue fever is Dr. David Hamer. He's a professor of global health and medicine at the Boston University School of Public Health with a special interest in infectious diseases. Dr. Hamer, welcome to the program.
Thank you very much for having me.
Now, for some background, cases of dengue have more than doubled since 2023. So to start us off, Dr. Hamer, what should we know about this rise in cases and how it affects travelers?
There's been a massive increase in dengue, in particular Brazil and parts of South America and the Caribbean in the first 6 to 7 months of this year. And then in Southeast Asia, as the monsoon season has swung through, there have been a lot of cases there as well. And it's much higher than usual. It may relate to changes in rainfall pattern, but also this having been one of the hottest summers on record. So climate change. But in any case, there's more dengue. Dengue is carried by mosquitoes. And so there's really been a surge in mosquito populations in certain places. The risk for travelers is substantial. And I run a surveillance network that's called GeoSentinel. And we look at returning travelers and identify what they're infected with and where they traveled. And we've just seen a massive increase in dengue cases this year. So there's definitely a risk for travelers. Dengue is an interesting disease because it can range from completely asymptomatic to fairly intense illness characterized by fever, rash, headache, eye pain, bone pain, and sometimes muscle and joint aches, to a disease that's called severe dengue, where there can be major fluid shifts and bleeding complications and potentially death. Now, fortunately, severe dengue only occurs in a small proportion of patients, although for people that are having dengue for a second time, there appears to be an increased risk of severe dengue. And there is a small risk of mortality associated with dengue. It's relatively small, but when you start having hundreds of thousands or millions of cases, even if it's only 0.1%, you end up with a lot of deaths.
Well, with that increasing prevalence in mind, which vaccines have helped prevent dengue in the past?
Oh, this is a really tough question. There are two vaccines that have gone through approvals in both the United States and outside of the United States. One of them is called Dengue. It didn't work so well because, complicated story, but basically it seemed to protect well against dengue-related hospitalization and severe dengue for a year or two. And then they started having breakthroughs with recurrent episodes. And they eventually figured out that it related to whether or not the vaccine was given to people that were previously seropositive or not. Those who were previously seropositive seemed to have a better benefit from the vaccine than those who were not. And this relates to a complex phenomenon called antibody-dependent immune enhancement, that may occur after somebody's had an episode of dengue. In any case, the Dengue ended up causing a major public health problem. That vaccine is being taken off the market because of concerns about both safety and its lack of efficacy against all 4 serotypes of dengue. There is a second dengue vaccine that is a live attenuated vaccine, and that went through approval by the European Medicines Association, and several countries in Europe have adopted that and are currently using that to protect travelers. It went through review by the FDA and ACIP, and the ACIP pushed for more data, and eventually the company Takeda that was making it withdrew the vaccine from consideration until they collect additional data. So right now we have no dengue vaccine available for US travelers. There is a newer vaccine made by both Merck and Butantan, company in Brazil, and that is a single-dose vaccine that showed 80% protection, but only against serogroups 1 and 2, because that's all they saw during the course of the trial that was recently published. So that looks good, but we don't really know how it works against dengue serotypes 3 and 4.
For those just tuning in, you're listening to Vaccination on ReachMD. I'm Dr. Charles Turck, and I'm speaking with Dr. David Hamer about prevention of dengue. So in addition to this perhaps up-and-coming vaccine, Dr. Hamer, what else can providers do to better prepare frequent travelers about the risks of dengue and other infectious diseases that are endemic abroad?
So dengue, like chikungunya, Zika, and a number of other viral infectious disease, is carried by mosquitoes, and in particular by daytime biting mosquitoes of the Aedes family. And so anti-mosquito measures during daytime hours, including early morning all the way through early evening, which are times of the day when these mosquitoes may be most active, are important to counsel travelers on using. These include wearing long sleeve clothing, lighter colors because darker colors tend to attract mosquitoes, and then using effective insect repellents. I think it's important for physicians to know about the epidemiology of dengue, including how it's transmitted, but also where it's being transmitted so that they can advise their travelers on anti-mosquito measures to help reduce their risk of having mosquito bites during travel to dengue endemic areas. And unfortunately, there are many, many areas of the world now, much of Latin America and the Caribbean, almost anywhere in Southeast Asia, South Asia, and increasingly coastal areas of Africa, but also the countries that border the Sahara have had big outbreaks of dengue in the last year. So there are a lot of places where there's a risk of dengue.
So it certainly appears we've been making progress in dengue risk mitigation, but what additional research is needed to improve our understanding and prevention of this disease?
There's a lot of open research questions. We need to understand the natural history of the disease more. There's actually some evidence that there may be a post-dengue, like a long dengue, where people have difficulties concentrating and thinking and persistent headaches that can last for several months after an episode. We don't know how often that occurs. I think the most important is really understanding how we can develop a vaccine that protects against all four serotypes and doesn't lead to an increased future risk of severe disease. Ultimately, an effective vaccine, and ideally a single dose vaccine, would be a game changer for travelers.
Before we close, Dr. Hamer, is there anything else you'd like to share with our audience today?
I think it's important for people to be aware of dengue, but also for physicians and clinical personnel to be thinking about that as a diagnosis in febrile returning travelers, but even sometimes in their own state or country, because increasingly we have the right vector in place in many parts of the United States and Western Europe. And all it takes is somebody to come in who's carrying dengue in their system. A mosquito bites them, goes on to bite somebody that hasn't traveled. And unless you're thinking about it, you're not going to make the diagnosis. So I think we need to raise awareness of the potential risk for local transmission of dengue as well as imported dengue.
Well, with those final thoughts in mind, I want to thank my guest, Dr. David Hamer, for joining me to discuss dengue prevention. Dr. Hamer, it was great having you on the program.
Thank you very much for having me.
For ReachMD, I'm Dr. Charles Turck. To access this and other episodes in our series, visit Vaccination on ReachMD.com, where you can be part of the knowledge. Thanks for listening.